Good morning. I'm so honored to have been asked to deliver remarks to such a dedicated group of healthcare professionals and advocates. The payers, providers, patients, policymakers, and innovators who are leading the way in ensuring that telehealth and related technology not only reaches our disadvantaged populations, but serves their specific needs. Prior commitments unfortunately prevent me from speaking with you live. But as we've all learned so well these past 2 years, it's the adaptability and flexibility of technology that provides us so many options for both personal and professional connection, as long as there is mutual will and access. It's these two factors, will and access, that are at the core of what will transform telehealth from an auxiliary benefit, just for some, to a life-saving pillar for the many, especially for those who are caught in the pipeline leading from inequity to illness. Disrupting this pipeline at both ends is the passionate aim of my friend Gil Addo, founder and CEO of Rubicon MD, and the team from HealthTech for Medicaid. Thank you so much to Gil and everyone at HT4M for putting this event together. Gil and I both pursued careers in the world of public health and healthcare because of experiences we had, both as the children of immigrants of color, who too often watched our family members struggle to receive the care they deserved. Though we took different paths to make the changes we wanted to see, for Gil, business entrepreneurship, for me, medicine and public service, we both got where we are by imagining how to align advances in science and personal health with the pursuit of social justice and the public good. And I think it's fair to say that never before in our lives, and possibly never again in our lives, have the need and potential for that alignment been so much in the public and political spotlight, and so ripe for action. This is because despite the great tragedies of COVID-19, it has also laid bare for the whole world to see just how limited and vulnerable even our greatest scientific achievements are in the face of deeply entrenched systemic racism and social, economic, and health inequities. Now, telehealth illustrates both sides of that coin. It's an amazing scientific achievement. And a platform whose possibilities are presently restrained by systemic limitations. But we should, at every turn, challenge those limitations as artificial boundaries. Before I was health commissioner, I was at New York City Health and Hospitals, the public healthcare system for the city, and the largest safety net provider in the country. We have toiled for years, for almost 4 years, in setting the telehealth strategy and slowly, painstakingly growing telehealth encounter by encounter, technology by technology, use case by use case. And it was slow, methodical, incremental work until March of 2020, when everything changed literally overnight. When we flipped our system into one where virtual care became the default for so much of what we were doing on an outpatient basis. And everything changed with that. Federal and state support, expanded reimbursement categories, and Medicaid coverage. Overall, we jumped from a pre-COVID average of fewer than 500 televisits a month to, within the span of just a few short weeks, 100,000 televisits and video encounters monthly. For me, this is forever etched in my memory, along with all of those other memories from March and April of 2020, because it shows me what is possible when there is the will to make quantum leaps. So it's about will, and it's also about access. We must collectively have and spread the will to make telehealth part of the solution to structural inequity rather than an accomplice to it. This means positioning equity as the number one purpose of telehealth, not a secondary consideration. This is so important because I think it gets at the heart of what you're speaking about today. Equity is not an add-on. It's not a sideshow. It's not something that is separate from the main event. It is the main event. And if we consider it, when we talk about telehealth, then it changes the paradigm. It changes the lens of what we have to do. We also have to intertwine that innovation and planning with the policies and conditions that make them accessible to all. And to spell it out, that work on policy and structural change is about anti-racism. It is about using anti-racist policy in order to shape the defaults that so much occurs within operationally. So those are big concepts and notions that may feel lofty, and we have to speak more concretely about how we do all of that. It starts with the fact that if you're here today, you're part of the answer, and creativity and collaboration across sectors, the sharing of ideas from conception to actualization, it begins with conversations like the ones that you will be having. And if you're part of HT4M, you have already made such practices part of your everyday commitments. I'm really excited to learn more about the work that you've been doing together and the ideas and plans that you'll develop today. We all do have so much to learn from each other. And what COVID again has confirmed for me more than anything is that the greater and the more urgent the challenge, the more patience and humility we need to confront it effectively. I'd like to take my few remaining minutes to share a broad overview of some of the work that my agency, the health department, and I have been doing around telehealth, work that I hope can both influence and be strengthened by your own contributions to the field. Starting from the beginning of the COVID-19 state of emergency in 2020, the health department put together a telehealth training package. This included instructional webinars, policy updates and information, and individual technical assistance offerings. These were made available to all healthcare providers in New York City, but targeted primarily to underserved neighborhoods. We communicated across New York State, not just the city, about why increasing capacity for and uptake of telehealth was a key COVID-19 recovery goal. And with partners at NYU, we conducted surveys with New York City primary care providers to track adoption and opinions about telehealth services. We focused mostly on small independent practices, which we know are vital to providing place-based, culturally sensitive care and are depended on by millions of New Yorkers. We learned that practitioners welcomed government's role in facilitating telehealth adoption and regulatory reimbursement practices. These are the best argument for ensuring that these changes made to respond to the pandemic continue permanently and are crystallized. Among the top concerns of respondents were the financial costs of sustaining telehealth services and patients' limited technological access, including home blood pressure monitors and devices that can accommodate video. I've seen this with my own patients. Even when such devices are technically accessible, they have complex user interfaces or English-only settings, and that means that their actual use becomes difficult, if not impossible. These frankly unsurprising results are why patient-facing technology has been at the heart of New York City's telehealth strategy, not just since COVID, but for many years prior. It's a little bit like the COVID vaccines and so many other apparently sudden science and health breakthroughs where the groundwork was actually laid for years. This harkens back to what I was telling you about our work at New York City Health and Hospitals, where we transformed our telehealth system. It felt like at the flip of a switch to meet the exponentially growing demand while continuing to serve our existing patients. But we had laid the groundwork for many years before that. This was very important because it allowed us to be strategic, and we focused on 4 key priorities. The first was keeping staff and patients safe. Second was managing finite resources. Third was maintaining access to care. And fourth was proactively serving the needs of the most vulnerable. We also recognized that success hinged on our ability to remain sensitive to the barriers of language, cost, and health and technical literacy prevalent in the populations we served. Now, significantly, despite real limitations in terms of human connection, there were unexpected, very human connections through telehealth as well. Again, I have to call upon a memory from the height of the pandemic when I remember how much a simple phone call to my patients meant. The fact that someone that they trusted reached out and checked in on them, particularly someone who had the medical expertise to help and answer their questions, speak to their confusion, try to assuage the enormous levels of anxiety that we were all feeling there, as well as the fear and uncertainty that so many of them were experiencing. I also remember talking to my patients about their family members and about how COVID affected their entire household. In some ways, particularly with some of the initial video calls that I was doing, it felt like I was making house calls. We were meeting them on their terms, under their roof, so to speak, and they felt comfortable talking about things in their lives that not only helped me understand them better, but also gave me clearer insight into everyday factors that affected their health and well-being. Thankfully, these previously unexpected benefits are starting to be seen as essential to improving our public health infrastructures. And more broadly, the shift to virtual care will help move the locus of care delivery further into patients' homes and communities. Just as we in the city are launching what I consider a transformative public health core, which is a $235 million once-in-a-generation opportunity to reimagine what public health can look like in New York City. The core will consist of hundreds of community health workers who will serve our communities and the ones that they know best, often because they are from those very communities. They'll link residents to clinics and social services, help people get vaccinated, counsel neighbors about diabetes and depression, address hunger and food insecurity, and much more. And importantly, this is all done through about 100 community-based organizations who serve as the connective tissue for the core within neighborhoods. We have to have this massive investment in public health right now, and we have to push the locus of care and health further into people's homes and into their neighborhoods. That's what the public health core represents, and that's what we have to meet with the work that you're doing in telehealth. Again, it has to be matched up with policy change, like New York State, which is planning to permanently eliminate telehealth site restrictions for Medicaid beneficiaries and make audio-only telehealth more available for Medicaid and CHIP enrollees. This is critically important to turn our beliefs into action, to do it at such a momentous time, and to take what will otherwise just remain declarations of concern and transform them into resolutions for change. So to conclude, let me just end on that note, which is about resolutions of change, because as you may know, the health department recently passed a landmark resolution on racism as a public health crisis. This was passed unanimously by the New York City Board of Health in October. It builds off of the many declarations nationwide calling attention to the public health crisis of racism. But we felt very importantly that this should be a resolution and not simply a declaration. We wanted concrete action steps that will hold us and the city accountable to facing what is a public health crisis in racism head on and doing the work of dismantling white supremacy together. So persistently and passionately improving and expanding telehealth in ways that alter the system rather than maintain it unchallenged or unchanged, in ways, in other words, that prioritize and directly serve those who our systems have traditionally left behind, that we consider central to our resolution success. But your contributions as partners in these goals will be such a key factor. So I'm grateful to have had this time with you to share a little bit of our vision about the next very important chapters for public health and healthcare and the role of telehealth. And I'm grateful to be able to do it through the power of virtual technology, which we should always remember has the ability to keep us all healthier and better connected. Enjoy the rest of the day, and I look forward to working with all of you soon. Thank you so much.